Good evening, Jeremy. Thanks for the warm welcome. Well, I am very pleased to be speaking with you tonight, and I want to thank you for taking the time because this is a subject that I'm absolutely passionate about, and it's my intention to share some great information with you that will inspire you to begin using and implementing the advantage that you have of having GSH complex in your lives. And by all means, if you haven't yet spoken with your physicians, I would strongly encourage you to do so, because the action of this product with the patients that I see routinely is profound, and it's something that I would encourage every healthcare professional to look into strongly, because the effects really are dramatic, and because of the unique aspect of glutathione in the body and all of the many ways that it functions, which I won't focus on tonight. I've been asked to focus on the clinical use of glutathione in the body and how patients benefit from its use. But there's so much great biochemistry out there, and even Harper's Biochemistry, which is the classic medical textbook on biochemistry that is used in every medical school in first world nations. So it definitely does warrant taking a look at. We have to remember that glutathione is a very, very large protein. It's composed of 3 amino acids, glutamate, cysteine, and glycine. And clinical research shows that when you ingest glutathione directly, pretty much all of the studies show that it does not appreciably increase actual intracellular, that is the amount of glutathione present inside of a cell. And that's really where it counts. That's really where you need glutathione present in order to enable all the remarkable things that it does. The beautiful thing about my experience with using GSH complex with patients is that it enables our patients to actually self-generate glutathione in an accelerated rate, and specifically in all of the areas of the body where it's needed most. I have been involved in clinics where we actually do IV therapy and, do direct infusion of glutathione into the body. But I have to tell you, quite frankly, the effects that you can get from regular use of this product will match anything that you can get through IV, and at a fraction of the cost. And lots more to say about that, but I will stay on topic. We have to remember that when our bodies get older, we produce less glutathione. And as we have less glutathione functioning in our bodies, ultimately we have impaired physiology, which leads to impaired metabolism, and that ultimately leads to degeneration and what we would call disease. And even beyond that, one could go so far as to say cell death. And again, lots more to say about that, but maybe for another day. What I can tell you is that the clinical use of having glutathione upregulated in your patients is profound. One of the top things that we use it for is to enable anyone with any degree of chemical toxicity to enable their body to begin naturally clearing toxins through normal routes of elimination. And that's really important. So any patients that you have with a history of chronic drug use, even if it's prescription use. A lot of people think that when we talk about chronic drug use, we're talking about illicit drugs. Those too, but we also have to remember that many patients are on medications prescribed by their physicians for years to decades, and that certainly counts as a history of chronic drug use. Drug abuse, people that use acetaminophen regularly, people that are exposed to environmental toxins because of where they live or what they do or what their hobbies are. Golf, for example, is one of the most toxic games in the world. I think it is the most toxic game, because you're getting exposed regularly to herbicides and insecticides and pesticides that they use to make those courses look so grand. Certainly poisonings. People who've lived on what we call the standard American diet, which is the SAD, S-A-D, standard American diet, certainly have plenty of chemical toxicity to address. It's also quite useful at helping the body to clear pent-up heavy metals. All of us get exposed to heavy metals. There's massive amounts of mercury in corn syrup, high fructose corn syrup. There's heavy metals found in makeups and soaps and solvents and off-gassing from industrial combustion. We are all inundated with heavy metals, and even molybdenum and cobalt have shown to actually be aided in clearance with using glutathione, which brings up the topic of helping people that are, coming out of having done chemotherapy. Many of these chemotherapeutic agents are high in heavy metals, such as cisplatin, which uses platinum to kill cells. And it's important not only to help clear those residues out of the body after they've done what they've been put there to do, but also to help with the collateral damage that has happened to the healthy tissue after a chemotherapeutic run. So it's quintessentially important, certainly with every cancer patient, not only for the sake of clearing the metals after a conventional approach, if your patients have come to you after that, but also to upregulate the body's own ability to actually repair its DNA and RNA and reverse precancerous syndromes and actually aid your body cells in actually fighting cancer, which has been well documented. We also use it for pulmonary diseases and disorders, asthma, COPD, cystic fibrosis, emphysema, bronchitis, among others. These all show remarkable effect clinically and in numerous studies with the use of upregulated glutathione. Anyone, too, nowadays knows somebody who has autoimmune disorders. We also know people that have allergies. These are just, different aspects of an immune system that's dysregulated. One of the beautiful things about glutathione in the body and giving the body the means to upregulate production when and where it's needed, which is what one gets when they use GSH complex, is that it allows the body to site-specifically rebalance and optimize immune system function. There are a lot of people out there that are always talking about increasing immune system function. And that smacks of amateurism, because the reality is what we need is a well-tuned, well-balanced immune system, much like Goldilocks, not too hot, not too cold, but right at the level that we need. We don't need a rampant, overpowering strong immune system. Otherwise, we get allergies of all kinds. Otherwise, we can actually promote the development of autoimmune disorders. But what we want is a well-dialed in immune system, and glutathione certainly enables the body to accomplish that. Along that line, it certainly is useful with every patient that has autoimmune disorders such as systemic lupus or Graves' disease or Hashimoto's or ALS or any of the other ones. These all generate from the same syndrome according to the biological medical understanding of things. It just depends on which tissue type is affected. And so glutathione really has an ability to help a person not only symptomologically, but also to resolve the background disturbances behind why these problems are expressing in the first place. But on the other end of the spectrum, with weak immune systems, there's also great clinical data, and this is why I say that glutathione also regulates, helps the body to regulate immune system response. Because people that are prone to chronic infections or who have long-standing viral infections, whether it be warts or always getting colds and flus or having herpes or any of these things, it helps to upregulate the body's ability to be dynamic and adaptive to meet the body's needs. Not too hot, not too cold. That's what's really great about it. Neurological disorders and diseases are also readily addressed with glutathione. There's loads of research out there on that. Such things as Parkinson's disease, Alzheimer's, even ringing in the ears, tinnitus with Meniere's disease. All of these things have had a great clinical research done and shown beneficial effects. Cardiovascular disease is something that also, many of our patients have. Heart disease, atherosclerosis, post-stroke recovery, post-MI recovery. These are things that, again, there's been tons of clinical research done showing the improvement. And I have to tell you clinically, with my experience in covering everything thus far that I've talked about with actual real people over 18 years experience and the 12 years that I've actually taught German biological medicine at 4 of the naturopathic medical schools, is that is helpful in all of these. I mean, there's direct benefit. And the beautiful thing is, we have to remember that it's always and only the body that does the healing in concert with God, the divine. We either work with the design of our bodies and augment and facilitate the feats of healing that only our bodies can do. There is no doctor or drug or surgery or herb or vitamin pill or IV drip that ever quote unquote heals us, but we can give the body the material and informational supports that the body needs in concert with the divine to accomplish feats of healing and cleansing that only it can. And when we give the body something like the ability to upregulate glutathione production, we really greatly facilitate its ability to physiologically and metabolically balance itself and put things into order and optimize healing even in grossly degenerated systems, which we would call diseases. Gastrointestinal disorders are greatly aided with the use of glutathione. Such things as inflammatory bowel syndrome, people with pancreatitis, ulcers, Crohn's disease, ulcerative colitis, all of these have been shown to have great clinical benefit of having upregulated glutathione production, as I can attest to. Interestingly enough, eye disorders and diseases, glutathione tends to be very, very high in concentration in the eye in the human body, and there's good reason for that. And when it drops, you'll tend to be more prone to eye disorders, such as cataracts and corneal ulcers. Interestingly enough, even a condition that's known as macular degeneration, for which there's really not very many good conventional options, responds well to having upregulated glutathione production. What else? Physical traumas are also useful. Any type of cut, contusion, bruise, sprain or strain, a break, overexertion, muscle pain, even for that matter, research shows traumatic brain injuries are all greatly aided by upregulated self-production of glutathione, which is exactly what the GSH complex helps the body to accomplish. So any time where there's a musculoskeletal disorder or disease, you should be considering using GSH complex, because whether we're talking about something like a connective tissue disorder or some form of rheumatism, or even classic degenerative joint disease, just wearing the tissues out, we have to remember that all metabolic and cellular cleansing and repair is greatly aided by sufficient amounts of glutathione. What else? Hormonal disorders, metabolic disorders, endocrine disorders, whether we're talking about adrenal dysregulation or thyroid dysregulation or blood sugar of any sort, high or low, whether we're talking about high diabetes or low blood sugar, hypoglycemia, these are all things that respond beautifully to enhance glutathione production. And in fact, with diabetes, a lot of the end organ damage and neuralgias are caused by massive, excessive oxidative damage that, of course, glutathione is tops in the body to address. And a lot of people, while I'm on the subject, will often think, well, do I really need this? Can I just take loads of vitamin E or vitamin C or selenium? And the answer, interestingly enough, is no, that's not enough. Those substances, which are commonly known as antioxidants, support the primary antioxidant enzymes in the body that do all of the work, that are the hardcore, battlecraft of getting the work done in the body. But they don't do the work that those enzymes do. And the top of those enzymes, by far, the absolute emperor of all, is glutathione. And so taking high amounts of vitamin C, D, A, E, selenium, all these so-called antioxidant nutrients, hey, that's great, but it's not going to do squat if you don't have enough glutathione. And taking them does not upregulate production of glutathione. Vitamin C and E and, vitamin C and selenium can maintain the duration or expand the lifespan of the use of glutathione as it's working in the body, but they will not induce production of it. You need to provide the body with the raw materials necessary to get that done. And the beautiful thing about how the GSH complex is put together is that not only is it providing you the 3 amino acids that you need in order to actually produce glutathione, but it's giving a complement of other proteins in an isolate form that's actually going to give your body the additional means to do the cellular production and repair of cells that is induced by the glutathione that's also induced by its use. So it's a really rather ingenious formulation, to say the least. And I have never had a patient that has not tolerated it, and that's saying a lot because I work with a whole huge span of people, some that are like the princess and the pea and others who are not.
Oh, yeah, well, I would have to say thank you on the part of GSH Complex for all the diverse analogies you've shown. However, we do have some, unfortunately, some limited time here.
Understood. Understood. Well, thank you.